5, 4, 3, 2, 1. Start. Heart attacks are becoming increasingly common in India, posing a major public health challenge. Over the past few decades, there has been a steady rise in the number of people experiencing heart-related issues, particularly heart attacks. This alarming trend is not limited to older adults anymore. Younger individuals are also falling prey to this life-threatening condition. The reasons behind this surge are complex and multifactorial, involving a combination of lifestyle changes, dietary habits, stress levels, genetic predisposition, and lack of awareness about preventive health care. One of the most significant factors contributing to the rise in heart attacks is the rapid shift in lifestyle. In recent years, there has been a marked transition from active to sedentary living. Many people now spend long hours sitting in front of screens, whether for work or entertainment. Physical activity has drastically reduced, leading to poor cardiovascular health. The body requires regular movement and exercise to keep the heart muscles strong and healthy. Without adequate physical activity, fat begins to accumulate in the arteries, increasing the risk of blockages that can lead to heart attacks. Dietary habits have also changed significantly, playing a crucial role in the increasing incidence of heart attacks. Traditional diets that once included fresh fruits, vegetables, whole grains, and home-cooked meals have been replaced by fast food, processed items, and ready-to-eat packaged products. These foods are often high in salt, sugar, unhealthy fats, and preservatives, all of which contribute to high cholesterol levels, obesity, and high blood pressure, key risk factors for heart disease. Regular consumption of such foods leads to the buildup of plaque in the arteries, which can eventually result in a heart attack. Obesity, often a result of poor diet and lack of exercise, is another major contributor. Excess body weight puts a strain on the heart, making it work harder to pump blood. Over time, this added pressure can lead to conditions like hypertension and diabetes, both of which significantly raise the risk of heart attacks. In addition, obesity can cause inflammation in the body, which further damages blood vessels and accelerates the process of atherosclerosis, a condition where arteries become clogged with fatty deposits. Mental stress and anxiety have also become common, especially in urban areas where the pace of life is fast and competition is intense. Chronic stress leads to the release of hormones that can increase blood pressure and heart rate, contributing to the wear and tear of the cardiovascular system. Long-term exposure to stress can also push individuals toward unhealthy coping mechanisms such as smoking, excessive alcohol consumption, and overeating, all of which are harmful to heart health. Smoking and alcohol consumption are widely recognized as major risk factors for heart disease. Smoking damages the lining of the arteries, reduces the amount of oxygen in the blood, and raises blood pressure, all of which increase the likelihood of a heart attack. Alcohol, when consumed excessively, can weaken the heart muscle, raise blood pressure, and lead to irregular heartbeats. Despite the known dangers, these habits remain prevalent and are often started at a young age, further increasing lifetime risk. Another important reason for the rising number of heart attacks is the lack of routine health checkups and preventive care. Many people do not seek medical advice until they experience symptoms, by which time it may be too late. Heart disease often progresses silently, with few or no warning signs until a serious event like a heart attack occurs. Regular screening for blood pressure, cholesterol levels, blood sugar, and body weight can help identify risk factors early and allow for timely intervention. Awareness about heart health remains low among the general population. Many individuals are unaware of the importance of maintaining a healthy lifestyle or do not know how to recognize the early signs of a heart attack. Symptoms like chest pain, shortness of breath, dizziness, and discomfort in the upper body are often ignored or mistaken for less serious issues. This delay in seeking medical attention can be fatal, as prompt treatment is critical in improving outcomes after a heart attack. Genetic predisposition also plays a role, with many individuals inheriting risk factors from their family. People with a family history of heart disease are more likely to develop heart problems themselves. While this cannot be controlled, it makes preventive measures even more important. For such individuals, lifestyle choices and regular health monitoring can make a significant difference in delaying or even preventing the onset of heart disease. Environmental factors are also contributing to the increase in heart attacks. Air pollution, especially in densely populated urban centers, has been linked to poor cardiovascular health. Pollutants in the air can cause inflammation in the arteries, increase blood pressure, and lead to the formation of blood clots, all of which heighten the risk of a heart attack. Exposure to polluted air on a daily basis puts a constant strain on the heart and blood vessels. Healthcare infrastructure and access to timely treatment also influence outcomes. In many parts of the country, especially in rural areas, access to specialized cardiac care is limited. Even in urban areas, emergency response systems may not be fast enough to handle heart attack cases within the critical time window. The lack of trained personnel, advanced equipment, and public awareness about how to respond to heart attack symptoms further complicates the situation. The economic burden of heart disease is another dimension that cannot be overlooked. Treatment for heart attacks, including hospital care, surgery, and medication, is expensive. For many families, especially those without insurance or stable income, these costs can be devastating. The loss of income due to disability or death adds to the financial strain, making it a social and economic issue as well. To address the growing problem of heart attacks, a comprehensive approach is required. This includes promoting healthier lifestyles through public health campaigns that emphasize physical activity, balanced diets, and stress management. Schools and workplaces can play an important role in encouraging fitness and healthy eating. Stop.